Welcome back. In today's Focus on Family, pregnancy prep, educating women before they get pregnant. And here now is Dr. Guillermo Font. He is an OBGYN at MetroSouth Hospital in Blue Island, where they are offering, get this, free preconception consultations through June. Thank you so much for being here, for joining us. First of all, why are women still waiting so long to get pregnant? Haven't we learned yet that our women's bodies were designed to give birth at a younger age than 40?
I think it's a matter of choice nowadays. Careers are lengthier, and women are in the working force.
Okay.
So we're seeing this more often. But there is a fact that we know nowadays is that the better you prepare for your pregnancy, the least complications you're going to have on the maternal side and on the baby side.
And how early should a woman start preparing?
Well, that is very controversial, but what we know is that 50% of all pregnancies are not planned.
Okay.
And that 30% of pregnancies usually start after 13 weeks gestation. So in an ideal world, any patient in their reproductive age group should plan for pregnancy always, because some of those. And how do you do that? Basically, you want to improve your lifestyle. You want to basically make sure that if you have any adverse health habits
like smoking. You know, we got some of your tips. If we could put that graphic up so that we can take a look at it.
So basically, every patient should be taking your prenatal vitamins.
All the time?
All the time. And those vitamins should have folic acid.
And the old stop smoking?
No, correct. But now folic acid is very important for multiple reasons. Number one, it decreases your risk for birth defects. Neurological birth defects, heart defects, cleft lip, cleft palate. And there's some studies also showing that it decreases your risk for premature delivery.
Okay. Stop smoking, both the woman and the the man, right?
That is also very important because it increases your risk for miscarriage, poor growth.
Smoking can also limit a woman's ability to even get pregnant, right? Okay.
That increases your fertility rate.
Limit that old caffeine and alcohol.
Yes,
that makes sense.
We know that patients who consume more than 200 milligrams of caffeine, they're going to have an increased risk for miscarriage. And also,
what is that, a cup or two a day?
That's probably more than a cup per day, yes.
Okay, wow.
Depending where you buy it, of course.
Work out.
You should exercise. Remember that exercise and diet improves your ideal body weight. And also, we know that patients who exercise enter pregnancy with less complaints of backaches, constipation, and it increases your risk for developing high blood pressure and diabetes.
Okay, and of course, monitor your diet. Are there any other tips that we're missing there?
Basically, you need to be prepared if you're in a reproductive age group. You need to update your immunizations, know well your family history, your genetic history. If there's any medical problems such as diabetes or high blood pressure, you have to optimize your treatment and enter pregnancy with a strict glucose control. Again, improve your diet, improve your exercise, take your folic acid.
Take those vitamins. And he's got a display here of the healthy things, ladies.
Well, folic acid is known to be present in your fruits and vegetables.
Oh, it's in all this. Okay.
Correct. So these are foods that are high in folic acid.
Good old Brussels sprouts. I love them.
But it is always important that you should take a supplemental vitamin with folic acid included.
And remember, ladies, the doctor is saying start doing this now. It doesn't matter if you're planning on getting pregnant next year or the year after. Start getting ready, right?
And the reason why is because 50% of pregnancies are unplanned. So if you try to plan for this
and wait, and you say women who are older and in careers are planners, but this can just okay. Dr. Font, I'm getting the wrap. Thank you so much for joining us and the tips. The MetroSouth Medical Center is offering free preconception consultations through June. To learn more, check out MetroSouthMedicalCenter.com, and for a link you can log on to WGNTV.com/midday.